occasionally, things happen that are really quite unpredictable, and this is one of them. Your mother had a hemorrhage outside her brain.
The subdural space.
So that's the space between the brain and the skull. Sometimes we can alleviate the pressure on the brain, which is very destructive to brain function, cognition, thinking, by putting a drain in.
Yeah, that's why I signed that. You know, when I talked to the guys about that, I said, yes, let's go for that if it's going to help.
So that was a very reasonable, appropriate management strategy. And unfortunately, not as much of the fluid came out the drain as was needed, and the pressure continued to push down on the brain, so it continued to have damage.
Yeah, I can see that. It's changed, especially in the last 24 hours.
So what we then see is sort of an overall loss of brain function in terms of response to questions, ability to respond and move things. And I think, as you're aware, the longer that the brain is under stress, the less chance there is for recovery.
Yeah, there's more damage.
Well, if you just have a stop in blood flow or a little blood clot, and someone has slurred speech, and then the blood clot moves on, they can have complete recovery. But once you start to have days and days of pressure on the brain, the likelihood that the brain function can recover becomes less and less and less.
Yes.
I think at this point, because of the structural damage that your mother's brain has undergone, that we cannot see that she could recover the kind of brain function that would ever enable her to live independently in any way.
And that's the only way she wants to survive, is if she could have a life. She didn't want to be propped up. That we talked about that before. She even came into the hospital for this because she accepted the chance that something could happen, you know. So, I mean, I can see a big difference with where she's at now. It's a totally different person. She's not there. I mean, even today is even... But anyway, my curiosity is, what is the process? What do you do now? I mean...
So, right now, she is being supported in terms of breathing and oxygenation by the ventilator. And she is not able to breathe adequately and control her breathing, partly because of the brain damage, or largely because of the brain damage. So that is supporting her breathing. She's not on other extraordinary life support measures, dialysis.
Yeah.
Like that. But I think that what we would all like for ourselves and for our parents is to, if there is no possibility of a quality of life that is acceptable, which I think tragically is the case here.
I agree.
That we would like those we care about to be able to pass on with no pain, with comfort, with no stress or anxiety, and with some measure of dignity and security with their family nearby.
I agree.
And so what we will discuss with the ICU team is making sure that your mother has no pain, no stress of breathing. We can do that with different medications, sometimes with pain medications, and very gently let her pass on.
Detach her from the ventilator?
Well, there doesn't need to be any extraordinary pulling out tubes or doing anything like that. I think we can see that she basically quietly moves into a deeper and deeper sleep. There may be, it's always...
The thing, there was so much relaxation. I was so able, that made other people more comfortable.
Well, I think it's not so much that any of us are afraid, but that we want to, of course, be very certain about making and recommending a decision like this.
Yeah, yeah.
So, and also, I personally feel that this kind of decision has to be made with everybody in the room, able to talk with one another, ask questions. This is not a phone conversation.
Yeah.
And so I'm very grateful that you came up today.
I wouldn't miss it for the world.
We appreciate your input.
Yeah.
An explanation.
Yeah, sensitivity.
Yeah, you just really thank you.
I have a couple questions.
Of course.
I just thought, so there's been, what, 2 MRIs? Have they done one recently?
They did CAT scans.
CAT scans, yeah.
There
I know
was
the coma test, whatever. I know she scored a little.
We did discuss whether to repeat scans to see just where we are. And I think the feeling of the neurosurgery service was that clinically, in terms of what's happened, the photograph doesn't mean anything. In other words, another CT scan. We have a loss of neurological function, which is irrevocable, which can't be turned around. And getting a CT scan means lifting onto the wagon, down to X-ray.
Yeah.
Right.
You know, we're willing to put our patients through all kinds of discomfort in the name of promoting health and taking care of problems.
Yeah.
I don't think this would be an exercise that would have any
benefit?
outcome benefit for your mother.
No.
Even if it showed that her brain moved back to where it should have been.
It would have no benefit.
The coma test, whatever, she has no good eyes.
And so the recommendation of the neurosurgeons, and I think also the ICU team is, you know, let's not do this test when there isn't a way that it can change outcome or medical decision.
Absolutely not, because she's unable. It's impossible for her to have the surgery that she would be necessary to wash out the blood that's there. I understand, and that ultimately the leukemia that brought her in here isn't treated still. You know, it would still have to. It's got its.
Just hold it at bay.
It would just be like get out of the hospital, maybe not really, but I mean,
Well, as you know, and as we discussed when I was meeting with your mother a few weeks back, the really difficult situation in patients over 60 with leukemia is that we have some measure of success in getting what we call a remission, meaning the disease, we can't see much leukemia in the bone marrow.
Yeah.
But the likelihood of relapse after one round of even aggressive chemotherapy like this, the likelihood of relapse is pretty much 100%. If you do more cycles of chemotherapy, the likelihood of relapse falls somewhat. But the overall survival for patients over 60 who have leukemia is very, very poor, even with a lot of aggressive chemotherapy after round 1.
Yeah,
and so, you know, if you are an active, vigorous person and someone says, look, there's a chance.
Yeah.
It's not a huge chance, but there's a chance, and we think you can tolerate the therapy, then it is a reasonable thing to go forward.
Oh, sure.
But in this situation now, you're very right that we have an irrevocably damaged brain, and if we were to be able to reverse a little of that, you know, your mother would then have, you know, no life independence.
No.
And you're right, the leukemia would be back in some.
It would be back. You know, it's because that from what she told me about her biopsy was that it was unchanged in her bone marrow. Nothing had changed. It was like it did not. You know, it killed all the leukemia in the blood, but it didn't get anything. The bone marrow still was full of blasts and all that stuff, and like she was really disappointed about that.
Well, and as you can imagine, we are too.
Yeah, but she's got a really aggressive flavor of leukemia.
So I just need the guidance from you if you would like me to go ahead and make plans with the ICU staff.
Go ahead.
Yeah, I was just to check with you. You know, I think we're here right now. I think this is a good time.